Imagine answering a carrier audit in exactly 90 seconds. I've spent over $50 million on Google and Meta ads, and I know the feeling of looking at a spreadsheet with 15 lead sources and realizing you can't tell which one is producing revenue and which one is just producing chargebacks. I built ClaimFlow as a working product to solve that specific problem, software that has already passed 145 internal tests. Right now, 28% of all federal TCPA lawsuits target the insurance industry. That is more than healthcare, real estate, or debt collection. For Medicare call centers, the legal risk is higher than any other vertical in the country. This chart highlights the scale of the crisis. CMS logged over 73,000 complaints in just 6 months regarding unconsented plan switches. As a direct result, the new CY2027 rule takes effect on October 1st, requiring call centers to maintain recording retention for a minimum of 6 years. Most dialers only store recordings for 90 days. If you're relying on that short-term storage and manual spreadsheets to track your history, the new October deadline makes your current data stack a massive liability. We've seen the consequences of a missing paper trail. One Florida agency recently paid a $990,000 settlement over calls made by their vendor, not the agency itself. Meanwhile, Allstate successfully defended a similar suit because they possessed immediate, verifiable documentation of consent. The defense only works if the paper trail exists before the lawsuit hits. Your data lives in isolated nodes: lead vendors, dialers, CRMs, and carrier portals. They weren't designed to talk to each other. When a carrier demands a recording, scope of appointment, and consent within 5 business days, you manually bridge gaps. If they mismatch, you lose. In this fragmented environment, a single missing piece of documentation results in an automatic loss. The solution is a single Medicare-specific ledger. Instead of scattered files, one continuous record traces a lead from consent to enrollment and renewal. Compliance and attribution are solved by the exact same data structure, providing audit defense and marketing data. This changes your operational speed. Instead of searching 3 systems over 5 days, you search a single lead ID and export a bundled compliance record, recording, SOA, and consent in 90 seconds. Every record is tied directly to the enrollment and stored on the required 6-year schedule. You aren't just saving files, you're building an on-demand archive that meets every CMS mandate. When you can produce verifiable documentation in seconds, a carrier audit is no longer a crisis. It's just a routine email reply. This ledger also fixes your marketing. A spreadsheet shows you which leads are cheap to buy, but won't show which policies stay on the books and which result in immediate chargebacks. By connecting calls to renewals, we calculate the renewal-adjusted lifetime value of every lead. 6 attribution models show exactly where your profit comes from. To prevent bad decisions, an honesty layer flags statistically thin data before you reallocate your budget. This also protects your commissions. For a 50-agent shop, undefended chargebacks can result in a $250,000 annual leak in revenue. ClaimFlow ties every commission directly to its originating call and consent record. When a chargeback hits, you have the exact documentation needed to dispute the clawback and keep your renewal commission. This level of documentation serves as active revenue protection. It provides the specific evidence required to win disputes that most agencies simply walk away from. You don't have to replace your current tools. ClaimFlow integrates directly with the dialers and vendor portals you already use, meaning you can secure your data without pausing your operations. This is a move from 90-day manual storage to a 6-year CMS-compliant workflow that operates in real time. Building this infrastructure from scratch requires engineering teams to handle encrypted retention, multimodal attribution, and native API connections. Based on the development costs of these 4 pillars, compliance, attribution, integrations, and defense, the total platform value is $142,000. For an independent agency, trying to build this custom data architecture independently would cost hundreds of thousands in engineering resources alone. Instead of those development costs, we use a subscription model based on your agent count, ranging from $399 to $6,900 a month. I am currently accepting 5 agencies into a founding cohort. For these 5, I am waiving the setup fee, a value of $15,000, locking your price for life, and handling your data import. I also provide a full 30-day guarantee. If you can't produce a carrier audit response in 90 seconds during your first month, I'll give you a full refund. Consider the impact. Avoiding just one $900,000 settlement justifies the platform for a lifetime. The same is true if you identify the 40% of your lead spend that never renews, or recover $40,000 in contested chargebacks. The clock is running. The CY 2027 rules take effect October 1st. 2 weeks later, the annual enrollment period begins. This is the window to build your infrastructure before the carrier document requests start hitting your inbox. You can continue to track leads in spreadsheets and hope the carrier doesn't audit you, or you can secure the infrastructure your agency needs to survive the season. Go to claimflow.health to claim one of the 5 founding seats. Secure your business before the October 1st deadline.